In the whole month of June, we've been focusing on various conditions affecting pediatric urological conditions. On this occasion, we're going to talk about something quite peculiar, which is cancer. You might be wondering, why am I talking about cancer in young children? In fact, surprise, surprise, testicular cancer only happens in younger group of adult men. In fact, we know testicular cancer commonly affects men between 18 to 38. And in this age group, sometimes it even affects men in adolescence between 18 to 21. Testicular cancer itself is quite peculiar and it's on the rise. We don't know why. Some people blame it on chemicals we're exposed to. Some people blame it on the hormones that men are exposed to. One thing for sure, if somebody has an undescended testicle, your testicle is closer to your core body temperature, then your risk of getting testicular cancer is 50 times higher. So there are effectively two types of testicular cancer: seminoma and non-seminomatous germ cell tumors. As far as the readers and also viewers are concerned, there's not much difference between these two. However, after we remove the testicle, because of the cancer, we will analyze it and see whether they are susceptible to chemotherapy or not. The interesting fact about testicular cancer is, number one, it happens in younger group of men. Number two, it's painless. So the testicle itself feels hard, like a nodular area that is not smooth, which testicle should be. And it is completely painless. And therefore, painless lumps in the testicle is cancer until proven otherwise. The third thing that is very peculiar about testicular cancer is that it is almost completely curable despite the stages. Testicular cancer are very receptive to chemotherapy. In fact, platinum-based chemotherapy can almost eradicate this cancer even in 4th stage. Therefore, the cure rate is nearly 97% if the patient receives chemotherapy. So, therefore, despite men or adolescents being young, we always teach them to do self-examination, because that self-examination, if they find a painless nodule, that can save their life, because testicular cancer is almost curable. For the month of July, we're going to start fresh. We're going to talk about various conditions that affect erectile dysfunction. And you might have heard that recently there was a study published to show that men who has got erectile dysfunction, whenever they remove their foreskin or they do an operation for erectile dysfunction, they realize that there's a lot of microplastics inside the actual penis itself. So what is this all about? If you want to find out, stay tuned for next week's Putting Dr. G on the Spot.